The golden rule of staying safe since the beginning of this pandemic has been to self-isolate and take off work at the first signs of any COVID-19 symptoms. But how does that work for a family of 5 living in a 3-bedroom apartment building with children and elderly in-laws? That's a tough reality for many Canadians right now, especially those living in Peel Region. And the disproportionate risk seems to be falling on ethnic and racial minorities. According to Stats Canada, Peel Region has one of the highest average numbers of people per household in the country, at an average of 3.2 people living under one roof compared to the national average of 2.4. Brampton and Mississauga are home to the largest percentage of immigrants in the GTA, and as Dr. Shaw explains, multigenerational living is common for many racialized communities.
Duty of a son to be with his parents, to look after the parent in their old age. And it will be duty in different ways of grandparents to make sure that grandchildren learn their language, culture, religion.
While the tradition has cultural roots, Shaw says it can also be an economic necessity for those forced to work low-paying jobs. Peel Region has one of the lowest capacities for remote work in the GTA, with more than half of workers in the region needing to be on site.
Workplaces have always been a challenge for transmission in the region of Peel. If you look at our plateau between November and the end of February, you saw that we the curve flattened out, but it never really went down despite having really restrictive measures in place. And that has represented our ongoing transmission between workplaces to home and then back into other workplaces.
Dr. Lowe and other health officials agree that a solid paid sick leave program is one of the most important ways to protect the community, but the Ford government's worker protection benefit has been under heavy fire from opposition leaders that point out 3 paid days off does not cover the 10-day minimum quarantine period for COVID-19. But even with time off work, finding a safe place to quarantine away from vulnerable family members isn't always possible for those living with multiple generations under one roof. With recent public health reports showing household transmission as one of the leading causes of COVID-19 spread, Peel Region introduced isolation hotels as a free option for people working on the front lines to quarantine away from home. While the idea might seem good on paper, Dr. Shaw says not everyone is able to leave.
When you are resource rich, you have options. If you have on a marginal income or minimal income, you don't have much choices. And so you have to go to work. You have to do whatever needs to be done.
I think the reality is we do our best and we make the offerings that we can, but there are some situations for which there are impossible choices. And I think that really speaks to the need to really just try to control this disease as much as possible in our community.
Peel Region has been ramping up vaccination efforts this month, launching a new joint program with the province to host pop-up clinics in local factories and warehouses, with plans for an additional 13 pop-ups in the coming weeks.
It's a big puzzle and you need to have all the pieces. So yes, you need to address paid sick leave, you need to address worker protections, you need to address getting more vaccine into hotspots.
Our health depends on other people being healthy, and whether they may be a frontline grocery store worker or somebody working as a truck driver, we are all interdependent.
For OMNI Television, I'm Eden Sveba.